Good morning, everyone. Today is Friday, January the 30th. I am Eric Feaster, Professional Development Coordinator for the Maryland Department of Health, Developmental Disabilities Administration. We welcome you to our Rate Review Advisory Group. If you would like to use closed captioning so you can read what is being said, click this button. Sometimes the transcription is not exact, but it's pretty close. Today's presentation is available in the handout section. Click here where you see the paper clip to download the presentation. If you have a question you would like us to read aloud and answer, click here where you see the question mark to add your question. All attendees are currently in listen-only mode and your mics and cameras are turned off. And with that being said, before we begin our meeting, we also want to ensure civility for all meetings. The free expression of diverse viewpoints is a fundamental value of our group. This freedom carries a responsibility to engage respectfully, which means treating one another with dignity and respect in good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or any harassment will not be tolerated, and it may lead to you being excused from the meeting. And now I'd like to hand over our meeting to our Director of Federal Programs, Rhonda Workman.
Thank you. I would like to introduce Nick Gabor to kick us off, our Director of Finance.
Thank you very much. Can you go to the next slide? Go to slide number 8, please. So today's agenda will include an update on the RRAG membership, followed by a discussion of our priorities for 2026. Next, we will review the 2026 rate rebase timeline and walk through the rate rebase process. We'll move on to the updates on our fiscal year 2025 general ledger template, a review of wage data, the BRIC model components, and 990s. Next slide, please. So members were sent an email with the August meeting minutes on November 3rd, 2025. And as co-chair, I'll make a motion to approve the minutes. Would a member like to second?
Chris from Somerset, I'll second.
Perfect, thank you. So it has been moved and seconded. All those in favor say aye.
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 All those opposed say no. Motion carries. The minutes are approved. I'll now turn it back over to Robert, and we'll go to the next slide, please.
Thank you, Nick. I just want to do a quick check to make sure that no one's hearing an echo. Okay, great. If we can go to slide 11, please. Thank you. So this slide displays the names of all current RRAG members. We would like to take a moment to acknowledge a few changes within the group. Shauna McCaughey, as well as Carol Custer, will no longer be serving on the RRAG, and we would like to thank them for their time and contributions during their tenure. We are pleased to welcome 2 new members, Jessica Gallatin and Matt Morgan. So at this time, I would like to invite all members to introduce themselves. We can start with Karen. Your mic is open, so we'll start with you.
Hi, Karen Lee from SEEK. Do you want me to send it to somebody?
Yes, that might.
Okay,
make
Matt,
it easier.
the new guy.
Matt Morgan from Fellow. David. Hi, everybody. David Irvin from Macomb, and I'll send it to Jessica, the new girl.
Guys, Jeff Gallatin with SDAN.
I'll jump in. Chris Parks, Somerset Community Services.
Hi, everybody. Laura Howe with Max.
Good morning, everybody. This is Greg Miller with Penmore Human Services.
Matt Rice with People on the Go, Maryland.
I'd like to turn over to our Hilltop and Optimus partners.
Good morning. This
Good
is
morning.
Steve Schramm with Optimus. I'll hand it to
Meg
Kristen.
Frenzen with, Meg Frenzen with Optimus.
Good morning, Kristen Deal with the Hilltop Institute.
Caleb
And good morning,
Levon
Alice
with-
Middleton with the Hilltop Institute.
Sorry, Alice. Caleb Levon with Optimus.
Hi, y'all. Brianna Colvin with Optimus.
Todd Switzer, Hilltop.
Great, thank you, everyone. I would also like to thank and acknowledge those of you who raised your hand to serve another term. We certainly do appreciate the contribution that you make to this process. If we can skip along to slide 13, please. So the following priorities were discussed during the last meeting of the calendar year 2025 RRAG cycle. Productivity factor, as well as acuity. We do plan to have in-depth discussion about the inclusion of a productivity factor in the rate during calendar year 2026. We did want to acknowledge acuity and let you know it is on our radar screen, but we will address it in the near future. In the way of background, we're going through the rate rebase process because it has been more than 10 years since we had a complete rebase. During past RRAG processes, DDA has talked about the need for a data-driven rate setting process to meet the CMS requirements for home and community-based setting rate setting. Both DDA and the RRAG have talked about the need to support and strengthen the BRIC model that DDA uses to set the DDA rates. This is an opportunity to use updated data from the general ledger data collection templates to improve and strengthen the BRIC model. The rebase also better positions DDA to meet the updated rate development and reporting, as well as monitoring standards CMS is imposing upon home and community-based programs. Next slide, please. Slide 15. This slide lays out our meetings and topics for the calendar year 2026 cycle. I do know it's a busy slide, but we'll go ahead and walk through it. It highlights the meeting topics that we have lined up for this cycle. Today, we'll be talking about background and process. We're going to discuss this schedule here, as well as our priorities. We're going to talk about the rate rebase process. how we'll be pulling wage and Bureau of Labor Statistics data into that process, the BRIC methodology, and our use of additional data sources. The second meeting, which will be in April, most of us will be pretty busy during the months of February and March with session. But at the April meeting, we'll be presenting some preliminary rebasing data from our analysis of the FY 2024 and FY 2025 general ledger data that we have received, including comparison with additional data as appropriate. When we come back in May, we plan to present the Bureau of Labor Statistic wage updates, as well as our analysis, and share the results by service. In June, we'll present our proposed FY 2028 rate updates. In July, we'll present our final FY 2028 rate impacts. And during the final meeting of the cycle, we'll be finalizing our FY 2028 rate setting and discuss our calendar year 2027 rate priorities. Though we are in session and anticipate being busy during February and March, we will still have the possibility of adding ad hoc meetings during that time as needed and as time allows, so that we can continue to do any work that we deem is necessary. On this slide in red are the targets for stakeholder feedback on the rate rebase components. During the April and May meetings, we will collect that feedback, and this will be after analysis is done on the Bureau of Labor Statistics standards. The new standards will be published in May of 2026. But we'll also, continue to work on subcategories, as well as program and policy changes and BRIC components. And we hope to have all of that completed. So following these discussions that will include feedback from you all, the June 25th meeting is when we'll share the draft FY 2028 calculated rates. And the July 30th meeting will be when we discuss those final calculated rates, as we mentioned earlier. Next slide, please.
Robert, I had a question about that slide. Is it okay to ask, or would you rather that we wait?
It's okay to ask.
Okay, great, thank you. If you don't mind just going back to slide 15. This is definitely a different cadence. And as much as, the legislative session is incredibly busy for, some of us, I'm kind of puzzled and concerned about the gap of meeting from January to April, and then compressing things from April to August. Feels like I guess I'm curious about what's going to be happening behind the scenes. I know you mentioned there may be ad hoc meetings, but, honestly, I think, what was discussed at the end of the last cycle was, with a rebase year, this group may need to meet more, not less. So I'm feeling perplexed about that big gap, and then it feels like it's just going to be reported to us, and sure, we can give a little feedback, but I don't know. It doesn't feel to me like the group is going to be as engaged as it has been in the past based on this schedule.
Sure. As I mentioned, there will be opportunities for these meetings, but as we progress through today's meeting, you'll get a good sense of the work that will still continue to be, that will continue to go on in the background. Both Hilltop and our Optimist teams will be working diligently analyzing data, and so on and so forth. So there will still be a lot of work going on. And again, we wanted, instead of having these hard dates for January and February, lend ourselves flexibility, and so that we can pull together an ad hoc an ad hoc meeting if needed. So
Okay, thank you.
so thank you for your comment. Slide 16, please. Okay, so as we are discussing the rate rebase process, we want you all to walk away understanding the process by which rates are reviewed and feedback is collected, as well as how we adhere to a structured process to support and build upon the existing BRIC methodology, our timely processes for collecting and review of feedback to enable long-term development and maintenance of DDA rates, data-informed and driven programs, and stewardship of public funds, and support the population we serve to help them achieve their desired outcomes. I'll now hand it over to Christine Dale from the Hilltop Institute to talk about the first step of the rate rebase process, and that's the base data, which was collected by you all by way of the general ledger data collection template. Next slide, please.
Okay, good morning, everyone. So we're going to talk through the different pieces of the rate rebate process this morning. So we've got 4 main topics we're going to try to cover. The fiscal 25 general ledger template, so provide some updates and how that data will be used in the process. We'll talk about wage data, the BRIC model components, as well as some additional data sources that's been pulled from 990 reports. So I will kick us off, and then I'm going to turn it over to my partners at Optimus to walk through the other pieces. Next slide, please. Next slide. Okay, so we've been talking about the general ledger template for several years now. And so it has been established as the data collection tool, and DDA has invested lots of time and effort to engage providers and provide technical assistance as needed. And so as we've been working with the provider community, the tool has been very iterative, and we've included ongoing stakeholder engagement and feedback to make the tool as efficient as possible in collecting the data to support the data-driven process. So the data collection for fiscal 25 marked the 2nd annual collection effort, and we will be using the data collected in the analysis for the calendar year 26 and fiscal 2028 rate rebate process. And so today we did want to share some highlights from the data collection process for fiscal 26. And so as our slide shows, you can see that we identified there was a total of 333 providers who delivered services in the community provider model and were required to submit a template. Of those, we received submissions from 211 providers, representing 63% of the target population. And so highlighting that we did not receive any template or information from 37% of providers. The Hilltop team was able to review each and every template and share feedback back. And so of those providers, the 211 providers who we sent feedback back to, we received a resubmission from 168 providers. So we are sitting at about 50% of the required providers. We have a template that includes data. So this is a 2nd or 3rd submission based on our feedback and engagement. And so while we have 50% of the submitted templates. We're still reviewing the quality of the data to determine if all of that data will be able to be included in the rate rebate process. Next slide, please.
Before we jump to the next slide, I just would like to say when we shared this updated data with Deputy Secretary Hutchison, she was just so elated with the progress that we have made. And we just want to, she wanted to make sure to share her thanks and her gratitude. 50% data submission rate is much higher than those typically seen in other states, and really demonstrates the continued growth of the partnership that has developed between DDA and its providers regarding establishing a data-driven rate setting process. And we see that as an encouraging sign. So thank all of you for helping to make that happen. Thanks to those of you who are providers who on your own time help share some technical assistance with other providers. Thanks. Turn it back over to you.
Robert, can I ask a question?
Thanks, Robert. Next slide, please.
Kristen, before you
So
bounce,
we did want to share some big key highlights from the fiscal year 2025 data collection and the improvements that we made over fiscal year 24. And a lot of these improvements really do go back to all of that great engagement and feedback that we received from providers. So we truly appreciate all of that ongoing, digging in and sharing your feedback and being willing to have those conversations with us, because it really continues to improve the tool. But those engagements did lead to higher rates of follow through in the submission process. So we had an 80% resubmission rate in terms of those providers who received feedback, and we asked them to submit more an updated template back to us. And so this was a 6% increase in the response rate that we saw in fiscal 24.
Two hands. Karen Lee.
Okay.
Do you want them to wait until you get through this?
We have one more slide on improvements, and then it looks like we've got some questions. So if you can give me 1 minute, we'll talk through and then we can go to questions. Okay, next slide, please. Okay, and so some other key highlights from this year is that we did actually receive templates from providers that did not require any feedback or updates. So this was an improvement over last year. We had given feedback to every single provider who submitted, and this year we had 30 templates that didn't have any need for updates. And then we also this year saw some improved timeliness. The templates were all submitted closer to the target due date at the end of October than we saw in fiscal 24. Okay, go ahead, Chris.
Robert, I just want to circle back. You made a comment in reference to the 50%. Certainly, I think we're all excited that the level of involvement here in the feedback, timing of the information coming in is certainly better. But you mentioned that 50% was higher than some of the other states comparatively. Can you elaborate a little bit on that?
Sure, I'm going to ask Optimus who have insights into other states that they service.
Sure, Chris, this is Steve Schramm. States on the low end might see a 15 to 20% submission rate for their initial data collection. And then on the high end, they might see 25 or 30% as they're starting out with a general ledger style data collection. It typically ramps up over time. And so DDA is doing well and still has some room to improve.
Okay, Steve, thank you for that. Just curious, I mean, we've had that 80% benchmark, I know, on final data, but are we willing to consider, because I think we've all expressed concern over the last couple cycles, that is a difficult target to get to. If we're significantly out in front time frame, where do the other states end up from a complete submission? Are they at 100%? Are they at 80%? Are they ended up, I mean, if they're starting out 15 to 20, are they ended up at 45 to 50 as their kind of final end result?
So it just varies. It depends upon whether the state uses incentives or sanctions as part of their follow-up. In a state like Maryland, where the data collection tool, the GL template, now replaces the cost reports, the 80% should be an achievable target.
Thank you, Steve. Karen.
I put my question in the chat, but to piggyback with what Chris is saying, is this not a mandate? And as Steve said, he used the term sanctions. Is there any repercussions, number one, for people who don't turn it in? And then my second question is about the demographics of the people who did submit. I had heard last year that 40% of DDA providers have under 40 staff, 40% have over, I think it's over 225 staff, and then the middle ground are people who have between 40 and 200 staff. And wondering if there's any way of looking at who it is that's submitted in terms of trends, and to make sure that we're getting data not just from large organizations that provide multiple services or just residential or whatever. That'd be helpful for me to understand.
Thank you, Karen. I can take the first part of your question. Yes, absolutely. The general ledger data collection tool has replaced the previous tool that was used under the legacy reimbursement methodology, and it is required. Target is 100%, and we are hard enforcing that, what's outlined in regulation as well as statute as far as sanctions. Providers who have not submitted a general ledger data collection tool, or one that is incomplete, will be receiving one last letter, and then the sanctions will kick in. So we are hard enforcing it. This data is very important for our process, as well as the audited financial statements. Those are also required. And so we'll be hard enforcing both of those requirements. And I'll turn it over to Kristen to talk about some of the demographic information questions that you've asked.
Hey, Karen, those are great questions. Last year, we were able to do an analysis of the data that we received. So we can look in terms of the services, the percent of services provided, the percent of participants covered by the submissions that we received. I don't believe we have staffing data by the agencies, but we can get a sense of the size of agencies that submitted versus those that didn't, given the services that they bill and the number of participants that they serve. So that data can be shared in the coming meetings this cycle.
Yeah, I really like what you just said, Kristen, about the percentages of people served. So that would be kind of, I guess, the high level question is, of the 50% that you're using, what percentage of the people who receive services in the state are covered by that 50%? I think that's the number that would be really powerful for us to understand that we're validated.
So we can certainly provide that. David, did you have a question?
I do, thanks. So sort of riffing off of, I think maybe Steve, what you said. I know that 80% has been a target. That's great. I'm desperately worried that we'll continue not to take critical decisions until we reach that mark, which I think we've sort of agreed, or at least debated, is a very, very high watermark. So we don't have to litigate it now, but I just wonder if there isn't some conversation that we can have through this cycle as to what is a reasonable and prudent data set on which for this cycle to base our rebase. Because 37% of providers not responding doesn't fill me with warm and fuzzy. And I'm concerned that we will continue to kick the can until we reach that mark. I think there's reasonable debate among reasonable people as to whether or not that is the right mark, and particularly against, Steve, your observations in other parts of the country where we're sort of hitting 45 and 50%. If it's good enough in other parts of the country, why wouldn't it be for us? So those are all sort of offered as rhetorical. And as we move into this cycle, I hope we can have that conversation, which dovetails beautifully, frankly, with Kristen, your responses to Karen's questions as well. If we've got a representative sample, then is the 80% really the threshold, or do we figure out how we contemplate what is in fact a representative sample and move forward on those bases? Thanks.
Thanks, David.
Okay, next slide, please. Next slide, please.
Kristen, you're on mute. We can't hear you. Kristen, you're on mute. Hello? Kristen, you're on mute. We can't hear you.
I'm on mute. Apologies. One final piece we wanted to share today was the improvements that we saw for the fiscal 25 templates and how the ongoing conversations are allowing us to target some improvements for the fiscal 26 data collection process. So some key pieces that we updated in fiscal 25 based on our provider engagement and lessons learned was one, we enhanced the template by embedding the macros to allow providers to customize the template just to have the services that they provide to streamline the size of the template and to make it more customized. We included the drop-down menus to help to simplify the way costs were added and to standardize across the network. We provided training videos tailored to specific feedback from providers in the prior year. Internally at Hilltop, as we reviewed the templates, we did utilize a secure internal AI tool to supplement our reviews of the templates. So this allowed us to target on specific pieces and provide really targeted feedback to providers and engage in some great conversations about the data that we were seeing and how the costs were aligning across their different categories. Next up, please. And so we want to share some updates that we're targeting for fiscal 26. And so we are again going to continue to update the template. We are planning a transition from the Excel form into a web-based platform. So providers would directly enter their information into this platform and no longer be required to submit the Excel documentation. The implementation of data quality measures and alerts at the time of data entry. So with this platform, we'll be able to immediately flag if data is missing, if data is in the wrong category, some pieces that we had a lot of engagement with providers in the feedback process. And so then we're anticipating a faster feedback turnaround time with the use of this portal. And so I wanted to share that in the coming weeks, we are going to be soliciting providers for a pilot group to test this new platform, engage with us on the process, so we can get feedback on the user experience and continue to enhance that provider portal prior to rolling out to the larger community. And so we will be including all of our RAG members and provider organizations in that request to participate in the pilot. So more information coming soon. Before I hand it over for the next topic, any final questions on the template or plans for the next cycle? Okay, I can now hand it over to Caleb to talk about the wage data from how the wage data from the GLs is used in the change for this year. Their use of the robust actual data allows Optimus to incorporate a productivity factor.
Thanks, Kristen. So previously, the rate methodology was based on wage targets using BLS data, and that specifically addressed provider feedback regarding the challenges of the minimum wage increase and staff retention over the last 10 years. With this rebase, and also with having 2 years of general ledger data, we have the ability to use the actual wages paid to DSPs in our wage estimates. And by moving to the actual wages paid, that also allows us to incorporate a productivity factor that the RAG has been asking for several years. Sorry, can we move to slide 26? So switching will allow us to use a productivity factor. And I also just wanted to remind everyone that we do always trend all of the expenses, including the wage data, forward to the rate cycle that we are developing. So all of this wage data would be trended forward to the middle of the next rate period. So that'd be December for the fiscal year 2028 cycle. Next slide, please. Although we are matching actual reported wages by providers, we want to talk about how we have traditionally updated the BLS wages and will continue to do so as a cross-check on the reported data. We will use the BLS wages to give us some sort of grounding or a way to interrogate the data that we receive. So the BLS updates the available data every year in early May, which drives some of the timeline that you saw in the previous slides. And that's, for example, in May of 2026, we will receive data for calendar year 2025, and then we could use that to update fiscal year 2028 rates. So last year we used calendar year 2024 data to update both 26 Q24 and also 27, although those rates haven't been published yet. The data reported every year is very similar. However, if there isn't sufficient data for some of the smaller occupation codes and smaller geographic areas, then sometimes BLS will suppress reporting for that data cell. So next slide, please. So here are some specific examples of the type of adjustments we make each year. For example, the wages for these occupation code 193039, which corresponds to psychologists all other, wasn't available in Lexington Park, which is St. Mary's County. It also, as you can see in the second bullet, it also wasn't available in Salisbury and Wicomico, I hope I pronounced that correctly, Wicomico County, or even the Maryland non-metropolitan areas. So in those cases where sometimes BLS has suppressed the data because there isn't enough, they don't want to identify anybody with their data, so they'll suppress it if the counts are too low in particular areas. So if that data isn't available, then we'll use the statewide value as a substitute. And we have to look at that, and it changes from year to year, exactly which occupation codes for which percentiles are reported in which regions. So that requires us to go through and make adjustments on that basis in order to derive wages for the statewide and the regional basis. Next slide, please. So then the next two slides are the occupation codes used to represent the direct service providers for each of these services. So you'll see the services in the first column, this BLS occupation code in the second column, and on the far right, the percentile wage used in the rate model. The most common code, and you see it a number of times in this particular table, is 211093. That's social and human service assistance. And the percentile on the right side is sort of the position out of all of the wages that BLS received. So 50% would be the median wage out of all the wages that BLS received for this occupation code in whatever region we're looking at. You know, those values, as you can see on this table, range from 50% to 75, or sorry, 50th percentile to the 75th percentile, to even the 90th percentile, where the wages in the model then are representing sort of the top 10% of the wages that BLS observed for that occupation code. Next slide, please. So this table just continues. So this is a list of all the services, so that's why it requires two tables to show all of this data. But you see some of the other occupation codes that we use, including, for example, psychologists, all other. We'll just highlight that one because that's probably the smallest group that they're collecting data on among the services we use for occupations. So that's the one that's sometimes missing for particular metropolitan areas, smaller metropolitan areas. Next slide, please. So the productivity factor that we've discussed is meant to account for the differences between the hours worked and the hours billed. And I know many of you have been involved in those conversations and are fairly familiar with this discussion, but for those that aren't, the issue is that we want to account for all reasonable costs, and obviously the workers for providers, the DSPs, continue to get paid whether or not they are billing or not. So we need to account for that non-billable time in which they're getting paid in our rate model. But previously, we couldn't implement this approach since we didn't have either the methodology or the data to support it, in particular specific wage data, but also the breakdown of that wage data between billable and non-billable time. And I know that can sometimes be hard if you're not collecting the data in that way, but that's what's needed in order to estimate that productivity factor. So the rebase that we are doing this year with updated actual wages paid provides an opportunity to incorporate that productivity factor. And let me show you how we do that. Next slide, please. So this is a little bit busy, but I'll walk through the pieces here to get to the final answer, which is down in the lower right-hand corner. But we start with the expenses, the wages in this case, for direct care staff that are billable. So we need you, and you have reported in the general ledger template in the direct care staff tab, items 1 through 3, you have reported the billable wages for that direct care staff. And in this example, this hypothetical provider, this is not real data to be clear, that amounted to $189,000 per year. Now we also need non-billable wages, the total wages in this example. Obviously can do a similar calculation using time values, but we're using wage values here. So we've asked you to report on the non-billable time wage expenses that are, and those are collected in the program support tab, which is item 11. And specifically in this example, and in the general ledger template, we ask about facility time, and this is wage expenses for DSPs that are doing other activities besides billable activities. So that might be maintenance or operations on the facility. That could be program support where they're documenting their own time, any trainings they receive, if their transportation needs to or from the client or other transportation needs, and then obviously general and administrative tasks. So those wages spent on time that is not directly billable to DDA is collected, and in this example it's $43,000 per year. We divide then the total wages, which is $232,000, by the billable wages, which is $189,000, which I'm rounding off obviously. When we divide those two values, we get 1.23, and that says that that's the productivity factor, and it tells us the ratio of total billable time to billable, or total wages divided by billable wages. The rate model would include that factor to effectively inflate the wages to account for the non-billable time. So we start out with whatever your actual wages are for the billable time, and then we can use this inflation factor to account for all of these other tasks. But I'm going to hand it off now to Dr. Steve Schramm, and he's going to walk through some of the details of the BRIC model.
Great. Any questions on Caleb's presentation on the wage data before I jump into the next section, which is the BRIC model and the additional data?
Steve, this is Karen Lee. We do this because we're supporting people in different states and so on. But we always also add in, because we're trying to figure out the number of hours per week somebody needs to do their billing. I think the CCS agencies also do something very similar to this to determine the number of people on caseload. And we also include things like paid time off and holidays. Is there a reason why you don't include that in the indirect?
I'll jump in that we do. It's not listed here, but that time is captured. Sorry. There's a line in the direct care staff items to get to that, particularly for that we would call those employee related expenses, and we'd capture that.
Is that under
well.
direct care staff, under that line, under the 188, or is it on the non-billable?
That would be non-billable time. Yes.
So that's where benefits go.
Yeah.
Okay, thank you.
I see Laura had a question, and David. I'm not sure who was first. I apologize, Laura.
Thanks, Steve. I apologize. I had to step away for a few minutes when this conversation started, but I guess I'm concerned about moving. First of all, I'm glad productivity is being factored in. So let me acknowledge that. I think that's great. I am concerned about moving away from BLS and basing it on what's being paid out of the rate, because it becomes a self-fulfilling prophecy that can either inflate or depress what then gets projected forward. So I don't know if I'm missing something, but that seems worrisome to me.
So we want to capture all reasonable costs, and the intention is to do that. We hope that providers are reporting their reasonable costs. I'll let Steve talk about develop that further in his discussions on the overall model.
So Laura, appreciate your feedback. Can you give a little bit more background on your concern about why actual wages would not be an appropriate base?
Sure. I would say that through a rate setting process, it becomes an easy way to depress future increases, and we lose that comparison to what is actually being paid in a broader way in terms of competition for these staff, because we do compete with other entities. So just, in a very simplified way, if there's a no rate increase and providers can't raise wages because there's no rate increase, then it inherently becomes flat, even though BLS broadly may increase. And it just becomes, I would say, a very easy way to go back to where we were before this rate setting began, which is there were no rate increases, so therefore there were almost no wage increases, which then led to a almost broken system of supports for people. So
let me ask a couple more questions, and then throw out an example to see if I'm following. So if a provider is not paying the BLS wage, you're suggesting that the state pay above what the provider is actually paying?
Well, you're gonna have a range, no matter what, of what providers pay. We see that. I'm sure you see that in the GL tools. And there's a lot that goes into what providers pay in terms of wages, where benefits factor in, where they run other programs. I don't think you've gotten to 990s yet, but some providers are able to fundraise, others are not. Some get county funds, some get considerable county funds, many do not. So there are so many factors that to say that it has to be, that rate increases have to be based on what providers are paying, I think skews what should be a data-driven process, because it can become it has the potential to become a self-fulfilling prophecy.
Okay, that's great feedback. I appreciate that. Thank you.
Thanks.
David.
Thanks for coming back to me. I'm actually going to withdraw it. I'm a little confused on the hypothetical example, but I think because it's so hypothetical that my confusion is at least reasonable. It does occur to me, though, that this is almost certainly the wrong way to frame this, but there's something of, and maybe this is Laura's or part of Laura's point, there's something of a homogenization of direct care staff, that rubric under which DSPs might fall, and or others who are doing direct supports to people. For me, it's, for example, if this, well, hell, I'll ask the question anyway. Does this represent a number of DSPs in that direct care staff line? Or is it so hypothetical that we've literally said staff, plural, and we've just assigned some number to it? If I'm providing certain ratios of DSPs to people supported, and Greg at Penmar is providing a different ratio of people supported, we've homogenized, if I'm looking at this correctly, Greg's ratios and my ratios as if they are one and the same, and they're not.
Sure. That's great feedback. Very helpful. So a point of clarification, when we do the rate setting, if we go back to slide 29 as an example, the way the rate setting is done and the way the productivity factor is applied, it actually is done by service, and theoretically, each service stands alone. Part of the challenge is that we want to make certain that there are sufficient data points for each one of these services. That's why we're asking for the 80% participation for the data. But to address your concern about, you may provide a different mix of provider staff. Theoretically, we are addressing that with the variation by service.
Thanks.
Any other questions? Karen Lee, your hand is still up. I don't know if that's okay. Great. Let's go to slide 34, please. So I'm going to talk about the brick model. Because we have new members this year, a lot of this information is going to appear repetitive for existing RAG members. And so I just want to lay that foundation so that people don't get frustrated with the timing of the presentation. So the key point that we're trying to make when we talk about the brick model and how the rates are built up is that our goal through each one of these steps, from the base data to the wages, the components that are based off the wages, and any additional adjusters or factors that we use, is to capture all of the allowable provider costs. And so as we go through the conversations, one of the things that was implicit within Kristen's discussion about the GL template and the updates is that we are constantly trying to fine-tune the instructions and the categories to make certain that we're capturing all of the allowable costs. So when we, for instance, talk about the base data and the reported wages, that is the foundation of a brick model. It always starts with the wages, and then the components are built off of that, but it's not unadjusted wages now that we're able to include a productivity factor. Because we have a productivity factor in this rebase, we're able to account for the billable and the non-billable time. And then we look at the sub costs by service to make certain that all allowable costs are being captured. The BLS data is now going to transition. Previously, it provided our wage base. Now, what we're going to use the BLS data for are checking to make certain that the reported information we have is reasonable, as well as trending the data forward. So the GL data is going to be a mixture of the 24 data and the 25. We're primarily going to rely upon the 25 information, but we will use the 24 information if it's deemed credible. And then we need to trend it forward to the midpoint of the time period for the rates. Those represent the base data that we're using. And then we need to convert that into wage information. So what we're going to do is look at the total expenditures, the billable and non-billable time, all of the different components. And this is this next step where we get to include the productivity component. so that we can account for non-billable time. The middle block in this looks at the add-ons to the wage. So there's employer-related expenses, there's facility expenses, program support, training, and transportation. You notice general and administrative is not in this block, and that's purposeful because the ERE, employer-related expenses, the facility, the program support, training, and transportation are a direct percentage adjustment to the wage. General and administrative is done as a percentage of premium calculation. And in later slides, we actually show the math of that, and I'll explain it. And then there's also some additional adjustments. And in fact, it's quite timely that we've listed service interruption because with the storm, I would imagine several of you have had facility closures. And so that's an example of the service interruption additional component that we factor in. Once we have those components, the base data, we're converting it into wage information, we're doing the percentage adjustments directly off the wage, then we do the percent of premium and the service interruption. We then have to look and see, well, what's the billable unit? Is it a 15-minute unit? Is it a daily unit? And we want to adjust for that. And then we also try to factor in acuity. So we've heard requests from the RAG to include an acuity factor. We have some acuity adjustments already built into the rate. And so as we talk in future rate setting cycles about additional acuity factors, we will talk about what we have now and what works and what does not, and ways that we might change that. This next step is very important to talk about terminology. So we use the term calculated rates to say we've gone through all of these 5 blocks: the base data, the wages, the wage-based components, the additional components, and then the final model elements to come up with a calculated rate. Other descriptions of that calculated rate, you may hear that as the fully funded rate. That rate is not necessarily the rate that DDA pays to its provider community. Based on funding available from the Maryland General Assembly and the governor's office, there's a funding percentage that gets applied to those fully funded or calculated rates that get to the final paid rates. Before I jump to the actual calculation, any questions about this process and some of the terminology that we're using here? Karen Lee?
The service interruption, if you could, what is service interruption?
So Caleb can give more detailed examples, but if there are snow days, if the state declares an emergency, we will want to have those dollars captured. Caleb, any other examples that come to mind?
Yeah, there was been incidences of hurricanes coming up and knocking out power, power outages, snow days, things that would shut down your facilities, but you still have to pay your employees. So we want to capture the cost. You're not going to be billing during that time, but you still have expenses. So it's intended to capture that. And it's, I forget the precise number, but 2 or 3%, 3 or 4%, something like that in the model.
So an obvious question would be to Nick and to Robert at this time is, when people fall off of the waiver because of the problems with EDD and providers are not paid, we still have to provide services and we still have to that it acts as the same impact as a hurricane for us, in that we aren't paid for that. So are you using this as an opportunity to calculate what losses happen to providers as the result of problems with Medicaid EDD system?
No, Karen, no, we would not build something like that into the rate. We see what's going on as a short-term problem that is actively being worked on, and we'll have different processes for how we continue based on.
And
you know,
Karen
what
Lee,
this
if I'm
partner's-
following your example, if I understand correctly, what you've described is an individual who's no longer eligible for the waiver. And so,
Yeah, that would be really great, Steve, if that was the case. These are people that are eligible for the waiver and should not have been taken off of it. It's problems in our Maryland EDD eligibility system. And so it's not their lack of eligibility that's causing the problem. It's the system and the disrepair in the system. So I'm not talking about when people are not eligible. I'm talking about when the system, the broken system, is not repaired and there's long-term damage fiscally.
so from a rate setting perspective, if this is a Medicaid issue, it is going to be challenging for us to address it through the rate setting. I think there was another question from Chris Parks.
Thanks, Steve. Just if you guys wouldn't mind re-clarifying for me, when you've got staffing ratio factor in the last column, can you cover that one more time, please?
Sure. So let's go back to, let me think about which slide has an example of staffing ratio. Actually, can we go to slide 30, please? So if you look at the day habilitation, you'll see different sizes that will factor in staffing ratio.
Okay, thank you.
Great. Okay, let's go to the next slide, slide 35. So this is an example of how most people are familiar with the brick model. And what I mean by that is you see on the far right-hand column, wages expressed as an hourly wage. And then you see the adjustments as percentages. And so I just wanted to connect the dots between the description that we had on the previous slides that talked about total dollars. And then here, this is what a lot of people see as illustrative examples of how the brick model works. You see an hourly wage, so $25 an hour, and then you see percentage adjustments off of that. The other thing that I wanted to use this slide to show is how the general and administrative expenses are calculated. Remember, I said it was a percent of premium calculation. And so you see that 8%. You just don't take 8% of the $25. What happens is you add up all the components to that point, and then you take that subtotal and you divide it by 1 minus the 0.08. That's a percent of premium style calculation. Then there are additional factors that get incorporated. You see we've listed billable units, staffing ratios. You would also potentially have the funding percentage before you get to the final paid rate. Again, the idea, we want to make certain that we are capturing all allowable costs. I now want to go into a little bit more detail on some of the subcategories, the ERE, the facility program support, training, and transportation. So let's go to the next slide. So in this slide, what we've tried to do, and this is a particular example, it's community living group home. We've tried to show some illustrative percentages and also give some descriptions of what the subcategories, the sub-costs might be in each one of these. This is an example of the work that the Hilltop team has done collaboratively with the RAG members and the provider community in general through things like the webinars and the training to define the kind of information that should be captured in each one of the categories. And you'll notice that it is not always identical depending upon the services that you saw mapped out in slides 29 and 30. So for example, in group home, there's no facility expense because of the way CMS does the rate development process. Now what I'm going to do is I'm going to jump to the brick model in the way we actually do the calculation. So next slide, slide 37, you'll see a wage rate. You'll see the different components. So after the wage is adjusted for the productivity factor, the ERE percentages, then you'll see a subtotal in the general and administrative. You'll see a service adjustment, and that service adjustment gets at the question Karen Lee had about, well, what is that meant to account for? Then you'll see we'll do some conversion. In this particular example, this is day habilitation 1-to-1 for the rest of the state. We have to figure out what the unit is and the staff per unit. And then that's how we get to a billable rate per unit. You'll see a total revenue figure down at the bottom of $289,000. Now I want to transition to how the information is captured with the GL template. Remember, in the GL template, we're asking you to provide us data directly from your general ledgers. Your general ledgers are not built on a rate, an hourly wage basis. So let's go to the next slide, slide 38. This is more like how the data actually come from the general ledger template. They come in total expenditure figures. So instead of an hourly figure for the total wage, you're going to see the total wage for this hypothetical provider A. They're going to report it based on the costs that are in their general ledger. At the bottom of that column, you still see that same $289,000 total. And that's how we make certain that we are capturing all of the costs that have been reported. So I want to make certain everybody's comfortable that when you see brick models, a lot of times what you'll see is the hourly wage buildup from a hypothetical perspective, whereas when we are gathering information from the general ledgers, we're doing it in a total cost perspective. And that's very purposeful. The reason we use the general ledger as the source is that it allows us to look at total expenditures and compare and contrast the information we have to make certain that it is reasonable and we can use it as part of our rate setting. So before I transition to the additional data, any questions on this brick model section? I see Laura has a hand up.
Thanks, Steve. I'm sorry, I'm not working in my normal space with two screens, so it's a little hard for me to go back and forth. Can you go back to slide 35?
Sure.
Just trying to understand. Just out of curiosity, is it a typo or am I misunderstanding something? If the wage factor, wage and productivity factor is $25, I didn't do all the math, but program support's 20%. Why would that be listed at $2? Was that just a typo or am I missing something?
1% is going to be 250.
Right.
Yeah,
It would be $5.
Yep, it's got to just be a typo.
Okay. Okay. All right. I just want to make sure I wasn't misunderstanding something. Thank you.
Apologize for that.
This is Greg. I have a question. On your next slide, when you get down to, so you break down to the hourly rate, does that rate include benefits or no?
So let's go to slide 36, I think. Is that the one you were talking about, Greg?
No, it was the last slide you showed right before you went back to Lars, the slide Lars.
Yep, so
suggested.
slide 38. So there is a very specific ERE component in this. Is that what you're asking about?
Yes. Is that,
Yeah.
So that's benefits and all the add-ons to the wage?
Yep.
Okay, so when you get down to the assumed actual wage per hour, that actual wage is just wage? Or does that 2372 that you're showing there, would that indicate an actual paid wage, or is that the wage plus benefits loaded into that 2372?
So if you'll humor me for a second, I'm going to have them go back up to slide 37. So that 2372 matches the actual wage that is calculated. Okay.
Okay. Thank you.
Any questions before we move to the additional data? And I apologize for the typo. I made a concerted effort on slide 32 to have it match the order of the rate components, facility, program support, and training. And I just did not update the category for the calculation. I apologize. That's my mistake, my error. We'll get that adjusted in the slides that get posted. Any additional questions before we go to the additional data? Okay, let's go to slide 40, please. So what we've talked about during the calendar year 25 and calendar year 24 RAG cycles was that in order for us to do the rate setting, we need to have a series of complete data sets to make certain that all of the assumptions and all of the calculations are consistent and make sense. Because we do not have a full and complete set of GL templates from all of the provider communities, we have begun to look at additional data sources. We have looked at the 990s and the audited financials. I'm going to walk through the 990s today to make certain that you all are comfortable with how we've pulled the 990s, and then you can give us some feedback. Karen Lee in the past has given us a little bit of feedback on some of the challenges of using the 990 data, and so we welcome that feedback because we use it as a reasonableness check, and so we want to understand what are the considerations we should be thinking about when we do use it as a reasonableness check. So first, the data source. There's actually a number of data sources available for 990s. 990s are required to be submitted by nonprofit entities to the IRS. So we looked at the different data sources, and generally, most people cite ProPublica's Nonprofit Explorer as the best and most consistent source of 990s. So we've included a link to ProPublica's Nonprofit Explorer to have you all, if you want, to see where we receive that information. The data that are pulled, we targeted fiscal years ending 22, 23, and 24. But I'm going to have to walk through an example so that you can understand how we pulled the data, because it's very confusing the way the data are referenced in any of the nonprofit data sets that show 990 financials. So let's go to slide 41 so that you can see a hypothetical example. So this is actually for the Humane Society in Arizona. And there's a couple things that I want to point out that make the use of this information challenging when you're referencing it. So you'll see up at the top, it says full text of full filing for fiscal year ending 2024. So when we refer to this data, we will call this 2024 data. But note that down here in the right-hand corner, this is actually a 2023 filing per the IRS. And so we just want to make certain that you're comfortable with how we're referencing this. If you look down here at row A, it says for the 2023 calendar year or tax year beginning 11/1/23 and ending 10/31/2024. So it's a bit confusing, and if we're ever using inconsistent terminology, it is typically going to be for a reason. And in fact, one of the later, the next slides has some confusing terminology on it. And so I want to make certain that everybody's comfortable with the way we're referencing the years. So let's go to slide 42. So this is a count of the Maryland DDA nonprofit providers that are in this publicly available 990 data set. So in calendar year 22, there were 118. In calendar year 23, there are 132. Calendar year 24, there are 92. Those are actually fiscal year ending numbers. The calendar year in this refers to the total number of DDA providers because I have to anchor it against a fixed number of providers. So this is actually a mixture of fiscal year ending for the 990s available and the calendar year ending for the DDA providers. Now, the good news is in the past, it looks like the number of providers submitting is pretty close to the total for the number of nonprofit providers and what percentage they've received of the total DDA payments. But remember, the count is not going to be 132 of, say, the full 297, because not all of the 297 are nonprofit. So in this instance, we're not expecting to see that bottom number ever get to 100%. It ought to be closer to something that gets at the total count of providers or the total for percentage of payments. So the calendar year 24 information, because of the lag that happens in reporting, the 92 is a little underreported. The 118 and 132 look to be fairly complete for the 990s. Next, what we did was we looked at the margin that was reported in the 990s. It's important to note the actual margin formula. So let's go to the next slide.
It's Steve, it's Chris. Before you run to the next slide, can you back up? I just want to ask you one quick question.
Yeah, absolutely.
So we've got our fiscal year. You've got the IRS year, which the IRS year on the form basically is the start of our fiscal year. So it's always going to be a year different. And now we've interjected calendar year in here. Tell me what calendar year is on this slide.
So the calendar year is, I had to pick a fixed time period in order to get a total number of DDA providers. So that's why you see the 326. I could have picked a fiscal year ending for the total number of providers. There's a bunch of different ways we could have pulled it. I used calendar year because I wanted to have it match up to the time period that we were talking about for the RAGs. So 265 when we did the calendar year 22 RAG process, 297 for the calendar year 23, and 326 for the calendar year 24. We could have picked a number of different time periods as the base.
That's certainly going to get confusing moving forward.
Yep. And so if you want, we can move everything to fiscal year ending. It's just, that's how most people, when we get feedback, get confused, because that's not a fixed time period. It varies by each provider. So you saw that the Arizona Humane Society, as an illustrative example, has a fiscal year ending in October 31st. So that's a sliding number. It varies depending upon which provider you're looking at. The calendar year ending is more intuitive for people, so it can be challenging to pick a consistent number.
Gotcha. So just to clarify, calendar year 24 is going to be anybody whose fiscal year ends on their 990 between January 1st, December 31st, 24.
When right now the 990 data is the 92 is for fiscal year ending. The 326 is for calendar year ending. and I can clarify this in the edits that I need to make for the deck.
Gotcha. I think it would be helpful because, again, if you look at it once a month, you're gonna be going, what the heck is that number and where's it coming from?
Yeah.
Just what I thought I want to share with you. I know you put in ProPublic a lot of success with what was GuideStar, now Candid. I'll be honest, I've never had trouble pulling 990, so that most of them should be there unless they haven't turned them in.
That's good feedback. Appreciate it. Any other feedback? Karen Lee, you had in the past mentioned some of the cautions when using 990s. Do you want to bring any of those up?
No, I think only in that if you do services other than DDA services, and if you do services in other states, those are just kind of some of the. Just a quick question, because I've lost track of this. Do you have to be a nonprofit to provide DDA services in Maryland? You have to, but do you still have to be nonprofit, or can you be for profit?
You can be for profit. We have for profits
Okay.
doing business
Okay.
in Maryland.
Yeah, we used to not be able to do that. I just wasn't tracking that. Thanks. I appreciate that.
Laura?
Thanks, Steve. Well, I have a lot of heartburn about using 990s because of all the complexities. I know you said I think you said it's a reasonableness check, but given that there are providers, well, first of all, there are for-profit providers. There are nonprofit providers that work in many different areas of different types of services. There are counties that give DD providers, all DD providers in their counties, a supplement. There are counties that only give certain DD providers funding because they've historically done that and they've continued it. There are providers that run thrift stores or have success in fundraising. All of that is going, or multi-state, all of that is going to show up on the 990. And I'm really struggling to see, I'm very concerned about using 990s as a component to a data-driven rate setting process. I mean, to me, maybe it gives you some sense of an organization's overall size and funding sources and profitability, but that an organization's profitability, this is about whether the rates are adequate or not. And those are two different issues because most organizations have a complexity of revenue beyond DDA, although certainly some are only dependent on DDA, which heightens the issue for them in terms of rate adequacy.
Steve, can you be specific about, to Laura's point, what is it that you would look for that you could find here and not anywhere else?
So,
and not in the general ledger tool?
Sure. The 990s do give us information on margin. They do give us information on reserve balances, cash investments, those kinds of things. And if we only have data from 50% of the DDA providers, this is a reasonable source for us to look at the overall financial position of the DDA providers in the state. And it allows us to look and see if the rates are adequate. Are we supporting the provider community in a way that they are able to build reserves and be fiscally responsible?
So I think the one thing that I would say is I really love the idea that a 990 can talk to you and can warn DDA about the health of an organization that's working with really vulnerable people. I appreciate that. I think, God forbid somebody that we work with dies and they leave me $50 million and it's going to show up on my 990, but I'm only allowed to touch it for people who don't receive DDA funding, let's say. It will skew your image of how healthy the organization is, but it's a restricted dollars. So the skill of looking at 990s and restrictions and notes and all of that, I think, we don't want to penalize. I mean, I do appreciate that it will, I think it's a good heads up for DDA to say, we better keep an eye on this organization. They're working with really vulnerable people, and they're struggling and they're having issues. But I think to use it for rate setting, as Laura said, I think that could be problematic because of all of restrictions on any dollars that might be related. So in a lot of this county dollars that come in, because Medicaid is the payer of last resort, they don't come in to pay for the services that Medicaid is doing because you can't stack that way. They're used for other things. So just the caution there. And then I would appreciate if after start looking at these, if you could come back and share with us what you're gleaning and what you're actually gleaning from them, and if it's of any real use. We should probably be knowledgeable about what bias comes from reading the 990s.
Sure, that's great feedback, and appreciate the comments about restricted funds. That's one of the reasons why both the 990s and the audited financials are important. It is very helpful to see in the audited financials the notes, and they describe the restrictions. They also help us understand the source of funds and the availability of assets, investments, those kinds of things. So it's really helpful feedback. Thank you.
Steve, I'm sorry, can I just add one more thing before we move off of this? Agree with everything Karen said. I just want to say, I really don't believe that 990s can be used to inform the department about whether the rates they are paying for DDA services are adequate. They can inform about the overall health in any given year of a total organization. But I want to give you one example. There are nonprofits that, 30 years ago, they use privately raised dollars, and they oftentimes use them either to supplement the inadequate rates, which we've lived through historically for decades. They've also used them to pay for things that DDA does not pay for. DDA does not pay for tickets for DSPs to go with to support someone at events. DDA doesn't pay for dental care. DDA doesn't pay for somebody to go on a vacation. And those are all things that affect people's health and quality of life, and private dollars that show up on a 990 oftentimes are used to either supplement costs that are underfunded through the DDA rates, or are used to pay for things that the DDA rates don't cover. So I really urge a tremendous amount of caution around this.
So that's great feedback. Thank you, Laura. Appreciate all these individual examples that you provide us, help us understand how we should be looking at the 990s. What are the subcategories we should be looking at? Same thing for the audited financials. It is very helpful for us to place this information and data in perspective, and we appreciate this feedback. Thank you. It's very, very helpful. So,
Steve,
Chris.
Yep, just real quick, just kind of reiterate and agree with both Karen and Laura on this. It's a tool that can be very well misused. Keep in mind too that most of the time the individual completing the 990 is their auditor. So you got a variety of auditors, a variety of way that they report things. Obviously, the form basically is going to turn into a third cost or a third data collection tool is what we're talking about. And it does not necessarily break everything out the way that you're looking for. And there is an absolute huge amount of room for misinterpretation. The other Pete, I think, other than the overall health and well-being of the organization, does not mean that their DDA programs are healthy. May mean that the organization is diversified and doing other pieces. And I would not want to see, cash reserves used in any way, shape, or form as a benchmark, even tied into rate setting. Those organizations go out there and they bust their tail to raise funds, like Laura was saying, Karen was saying, and it has nothing to do with the rates. They're doing it to compensate for a lack of rates.
Great. Jess?
Yeah, I just had a quick question. What is the reason to look at the 990s? Is that because we have that lower threshold of GL tools? Is that the policy of looking at them because we didn't get to meet the benchmark? Having only 50% of it, is that when you would go and look at those 990s? Or so if you get sufficient data from the GL tool, do you just bypass this step? And then my second question is, do you look at entities that did not provide a GL tool at their specific 990s? Are you looking at it as a whole?
So the answer to the first question is we probably don't eliminate the 990s or the audited financials, even if we get to 80% of the data. We always want to have additional data points for reasonableness checks. But we do not give the 990s or the audited financials full credibility at this point because of the clarifying points that Karen mentioned, that Chris mentioned, that Laura mentioned. And then your second question, reiterate it for me.
Sorry. I just wanted to know if you're going to look at all of them as a whole as a checks and balance type situation, or are you going to be looking more specifically at the absence of a GL tool from a certain entity at a 990 to extrapolate data?
So we'll look at all of them, but we won't lump them all together. We will try to split them out by which services the entity provides based on what's in the GL template, but we know that is not a perfect split. And so, as I said, these are a reasonableness check and we don't give them full credibility, but they are a data point that we would look at. And it's not dissimilar from how Maryland, the Department of Health, when they do the rate setting for the managed care program, look at the overall financial experience of the managed care plans. So,
Steve, I just want to make sure we're being cognizant of the time. I believe we're down to about 14 minutes and would ask that we get through the remaining slides and then we can open it up for questions and comments, time permitting.
Great. Thank you, Robert. So next slide. So it's important to map out. This seems like a really simple point, but there are a lot of different margin formulas that could be used. And we use a very simple formula: total revenue minus expenditures divided by revenue. The next slide shows an array of all of the providers. So slide 44, please. So what we've done is, if you look at the table, we had 92 providers where in the fiscal year ending 24 timeframe, we had data. So you'll see numbers 1 through 92 across the graph here. Individuals who have entities that have negative margins will have a blue bar that goes below 0%. Entities that have positive margins we'll have a blue bar that goes above the 0% line. This is just 2024 data. These are for only nonprofits who reported 990s. And then we added the red crossbar to identify entities that have margins of 10% or greater. And that was actually because I see Greg peering intently at this. So Greg, we had a conversation during the last RAG where I had mentioned we've begun looking at the margins through the 990s, and you asked, could you provide that data set? And so this is the information that I was referring to. What I mentioned during that conversation and during the mid-set conversations had to do with a margin target. You'll hear for Medicaid managed care programs, margin targets of 1 to 3% on a rolling 3-year average. The Maryland Health Choice program uses 1.3% as a specific margin assumption, but that's not appropriate for a DD program. In managed care, you have very large cell sizes. You have population health management, whereas several of you have already mentioned the challenge in DD programs is you have very small programs. And so there's going to be a lot more variability. There is no hard and fast rule for what a target margin ought to be for a DD program because of those size variations. On the low end, you see margin targets discussed of 8 to 10%. And then you also hear margin targets discussed of 10 to 12 or 10 to 15%. So we just picked that tipping point to show the crossbar so that you could see, hey, what percentage of entities have margins below 10% in this illustrative example, and what percentage have margins above 10%. Chris?
Yes, Steve, just thank you. Your formula is total revenue minus total expenditures over total revenue. I got that part. You're talking about total revenue off the 990. You've not dissected the DDA program out of it because I'm not sure you 100% could.
Correct. Yeah, it's a great
There's
point.
no way to, but there's no way to use this benchmark to compare it because I could have multiple other programs. I could have a for-profit entity buried within that 990. It really is I hate to say it, but it's a crappy benchmark.
I don't disagree that the benchmark needs to be used with caution, but I wouldn't characterize it as a crappy benchmark because we can look at the 990s and see how much of that revenue matches up to the revenue that is paid by DDA. And so we had Bruce from Hilltop pull that, and we're going through and we're comparing those percentages. So to get at Jess's question about how we use this information, we'll provide higher credibility to information that we have a much higher percentage of the DDA payments matching the 990s. So it's good feedback. We appreciate you pointing that out. That's all part of the credibility adjustment that we would need to make for any use of these data.
Sure. And Steve, I'd follow that up with, if you're able to, maybe next time we get together, take a 990, show us how you're using it, go through, hey, I'm pulling information from here and there, and I think that would maybe help. I still would have significant concerns. To me, I'd rather see the audit. The audit's much more clear than the 990. It's a document that's shoved together for IRS tax reporting purposes. Obviously, no taxes for the nonprofit, but it is so muddled together that it could be very skewed and very misused.
We appreciate the feedback. That was why we wanted to present this at today's meeting so that we could have this level of exchange. Very helpful. Thank you, everyone. I'm going to now hand it back to, I apologize, Laura, I missed your hand.
Thanks, Steve. I just want to say, as it relates to profitability, because I hear that that's an interest. So a lot of feedback that we've gotten from members is that as providers, and this is not for everybody, let me just be clear, but for some number of providers, as they go into LTSS, and they get that, for some of them, they get, a nice bump in rates, which was the intent of rate setting, was to, improve rates and make them more adequate. The profitability goes up for a few years as they see what the predictability of the revenue is, as they feel confident that they can increase wages safely with some predictability of revenue. And as they then increase wages, which is a great thing, that profit margin tends to go down. And we're hearing that from a lot of the auditors for community providers. So I just wanted to mention that, in terms of years that you're looking at years that straddle that transition into LTSS. There are providers that had, the kind of bridge payments that are sitting there on the books as well. So I think in terms of profitability, I just think it's complicated.
Appreciate the feedback. Very helpful. This is exactly the kind of exchange we wanted. I'm going to hand it to Robert for the open discussion and public comment.
Thank you, Steve, and thank you, members, for all of your thoughtful comments. Before we move on to public comments, are there any walk-on items? Okay. Nick, you want to lead us through the public comment section?
Yeah. So. There we go. Okay. So thank you, Robert. So we will be limiting the public comment to about 3 to 5 minutes, given the time we have, but we do have a few minutes remaining for any member of the public who would like to chime in. Please place your comments or questions in the chat, and we can read them as we receive. Yeah, go ahead, Jessica.
Talking about me. Okay.
I
Sorry.
saw you.
Sorry. I just had a really quick question, because this was a lot of just information giving today, and our next meeting is not until April, and I know that we went through that timeline with the possibility of adding meetings in February and March. How do we determine that, and when do we know about that? And does this group decide if more meetings are needed? It's a very big gap. I don't know. Sorry, I just don't know how all of that works.
So Jessica, what we'd like to do, because you're one of our new members, is reach out to you and kind of do a mini orientation to the Rate Review Advisory Group, and then answer any other additional questions you may have. Mimi, would you like to go ahead with your question? This will be the last question. Eric, are you able to unmute Mimi?
Hi, thank you. So going through the whole presentation and everything, I was seeing and very much appreciate that there was a lot of quantitative data being used for this analysis. I was also wondering if in discussing rates and services in Maryland, if there was in the future going to be qualitative data introduced into the study, such as also like I just blanked for a second, I'm sorry. The services provided, the quality of them, how participants who receive services from, from certain providers, if there is a trend in satisfaction with services compared to rates that are being paid to employees. So things like that, if the more qualitative points are going to be included later on.
Thank you, Mimi. Great question. So there is interplay between this group, this advisory group, and the Waiver Advisory Council, as well as other committees or councils that we have that will help inform policy. The purpose of this, the primary scope of this committee is to assess those policies to determine if there's an impact rate or if it necessitates a change to the current rates. And so we do get qualitative information from other sources that impact and inform policy. So in thereby extension, it lands here as there are policy changes. So it does help to inform those rate decisions. I just want to again thank everyone for their attendance. Our next scheduled meeting is May the 28th from 2 to 4 p.m. We hope to be back to our hybrid format. For those of you who want to join us in person, we will make sure that if we schedule an ad hoc meeting, we give some notice for folks. We know that everyone is busy, and we'll try to send it out as soon as we can before the actual meeting date. Thank you, everyone.
Need to officially adjourn. Do you want to officially adjourn?
Yep.
Okay.